Hi, it's Denise Folsom from the Legacy House, and I'm in my office today. And I just want to talk to you about one of the things that I've been seeing recently in my very young clients, 3, 4, 5 years old. About this time of the year, it is typical to see on TV and things that are out is we see scary movies, we see we see things about Slender Man, Bloody Mary, those things I'm hearing. But I wanted to just kind of talk to you about the difference between an adult and even an older teen seeing those things, and then somebody who's 3, 4, 5 years old. There's a significant difference in brain development, what they can handle, and what they can differentiate between what's real and what's not real. So when you're dealing with a 3, 4, 5 year old, we've had just a whole issue with in our year here, Hurricane Michael and then COVID. We've talked about masks being very different for children than they used to be. Before, masks were Halloween, and now masks are everywhere. And so that's one of the things that they're become confused about. That they used to have a virus and it was a stomach virus and they stayed home for a couple days, and now there's a virus and they've had to stay home for months. And so just that is a little bit of a difference in how they think. But also when you turn 3, 4, 5, your imagination intensifies, but yet your ability to understand that that's not real has not developed yet. And so you're going to see some common fears. Animals, bathtub drains, thunder, things like that. In my playroom, the doctor who had my office before me had a shower installed, and so there's a shower curtain. Never thought that this would be a source of fear coming into the playroom. And so one of the things that's different as a therapist that I do, they'll say, "What's that?" And I'll, and I'll respond to that, and then they'll say, "Open it," and I'll say, "And here you to do those things." So I'm not protecting them from that. I'm not going to remove the shower curtain. I'm also not going to open it, but I'm going to make sure that they feel safe in their exploration of what that is, and that it's okay to be afraid. But you're going to see, an increase on television and movies. And so I just wanted to caution you about some of the things that children may take. You may know that these things are not real, but the child, 3, 4, 5 years old, does not have the ability to really say, okay, that's not a real thing. We don't want to always cushion them from everything, but we also don't want to just throw them kind of into the deep end of the pool. So we want to accept their feelings, and we want to say, that's a scary thing. I'm hearing Pennywise again. I'm hearing Slender Man. I'm hearing Bloody Mary. I'm hearing something I had to look up this morning, and what's Slappy. And so what can seem very innocent for even, middle school, high school student at 3, 4, 5, they do not have the ability to understand that ventriloquist doll that comes to life in the movie, is not real. They're going to have to learn those things. They're going to have to learn what to do with those coping skills, but that takes actual brain development. And so we want you to validate the child's fears and acknowledge, don't minimize that is a concern. And we want to begin to talk about ways to deal with fears. How do you not come into that caveman part of your brain? How do you begin to use that? But you're also going to teach some regulation skills. We talked about 5, 4, 3, 2, 1. We've talked about triangle breathing. We've talked about butterfly breathing. We've talked about all those things. And then we want also to have them think about where in their body do they feel that fear, and what can you do? I work with children a lot who have nightmares in the middle of the night, and it's not that they don't go to their parents' bedroom. We want to empower them to try some things before they do. We want to change their nighttime routine. We want to restrict some of the things that maybe your older elementary and middle school students can watch, but your 3, 4, 5-year-olds, they do not understand that these are not real things. I work with children pretty regularly. It's something that they see in a video game, something they see in a book, and then they really do think that that's a real thing. And as their brain develops, and as we empower them to face those fears and give them the skills to face those fears and the supportive environment to face those fears, then they will be able to face those fears. But I just wanted to clarify that sometimes if a child thinks something is real when they're 3, 4, and 5, it's because they don't have the brain development. They don't have that cognitive ability yet to differentiate. And so we want to accept the feelings, we want to restrict what they have access to, and then we want to also give them the skills to be able to deal with those fears, because we know that having those skills at 3, 4, 5 to face fears and deal with overwhelming emotions can definitely be used as they get older. So just wanted to prep you a little bit for Halloween. Hope that helps. Thank you.